Dear students, this is your presentation on Vital Signs for Nursing 102. You should have your Kosher book open to chapter 29. We'll begin by talking about the significance of vital signs. When you think of vital signs, you should think of them as being the human response to illness or condition. Vital signs could also be normal, so the body could be in homeostasis. When you think of vital signs, remember that they're not just a routine thing that is done. Rather, we want you to approach vital signs as being something that involves a thoughtful, scientific assessment. Vital signs allow the nurse to compare the patient's vital signs to a baseline, but also to acceptable, normal standards. For example, you're going to learn that a normal pulse rate is 60 to 100 beats per minute. And so if your patient has a pulse rate of 40, you'll note right away that there's a problem. The vital signs are typically temperature, pulse, respiration, and blood pressure. Your book mentions that sometimes pain is considered the fifth vital sign. And then in some cases you'll also read that the pulsimetry is another vital sign. And we'll talk about both of those later in the semester. But for today's presentation, we're going to focus on just those four: temperature, pulse, respiration, and blood pressure. Why are vital signs considered vital? Well, vital signs give us a clue about the basic physiologic functioning of our patient. They also offer a quick way for the nurse to evaluate whether the patient is well or whether they're sick or they're experiencing a problem. Vital signs also give the nurse a way to evaluate whether a medication or a treatment or an intervention has been effective or not. When do nurses assess vital signs? Well, again, if you want to look in box 29-1 in your Kosher book, it does give some common situations where vital signs are obtained. For example, you have a brand new patient that's admitted, or you have a patient that just returned from surgery, or perhaps the patient is on some sort of medication, maybe a blood pressure medication, for example. That's very common. Or maybe you've just taken the patient for a walk and it's the first time they've gotten up after surgery, and you want to monitor their vital signs to make sure that they're tolerating the activity. Another example that you see in your book is a blood transfusion. There's a high risk of complications with blood transfusions, so we're monitoring blood pressure and other vital signs commonly during blood transfusions. Now, here's the next question that's important, and I want you to think about it. What is the difference between an unlicensed assisted personnel, in other words, a nursing assistant, and a nurse when vital signs are obtained? I know many of you already are working as nursing assistants, and you're already very adept at obtaining vital signs. You know the procedure backwards and forwards. But as you enter the nursing profession, you'll find that there is a difference between the two. And when it comes to nurses, the nurse is ultimately responsible and accountable for obtaining the vital signs, for ensuring that the vital signs were obtained properly, but the nurse is also responsible for interpreting that information and making a decision about it. So that's where the difference comes in. The nursing assistant has been delegated to obtain vital signs, but it's up to the nurse to decide what to do with that information.